how wonderful it is to see acupuncturists from countries around the world.
面对世界针灸医学的发展，世界针联将进一步加强与世界卫生组织合作。
Today I'm going to be talking about the use of acupuncture and Asian medicine here in the United States.
我的这个报告的题目是这个真实世界的临床研究。
It's going to be more about the mechanisms of acupuncture and how acupuncture works specifically in chronic pain patients.
I don't need to say much more about how important research in evidence-based medicine is for acupuncture, particularly in the Western world.
有据可查，最早的这个是我们上海，是1958年8月30号，上海第一人民医院做了这个手术。
1958年这个8月28号，还有一个是住院医生，叫殷卫珠，就是他跟我开始搞那个针刺麻醉，他跑来问我一个怪问题，他说：“王主任，你这个镇痛这么效果好，你到底有没有麻醉作用？”他轻松的一句话了，我给他问倒。我想我们做了那么多年医生，这个痛啊，总是病人痛了以后才叫我们来针灸的，没有什么一个病人还没痛跑到我们来针灸，没有的。那我说你这个麻醉情况不一样嘛，他还没痛嘛，你就要坐在他前面。我想这个事情一个办法只有自生试验，所以晚上我回来就做很多试验了。这个皮肤节制加上去，就不是一加了要叫了。可以加到3次还能够耐得住。第二天就跟他讲，我说我估计有点麻醉作用。那么他说，哎，我就要个病人吧，就做那个扁桃体插入了，那个小手术了。那万一失败，在手术台上怎么样？他说你这个不要担心，如果病人叫痛，我马上那个清热麻醉喷上去，解决了。他说不会痛了。我说这个保险，我说去做，一力做成功。
推行这个针刺麻醉，就说最高潮的时候，那50年到70年之间嘛，那时候我是全国写字组的组长，具体临床上是我来管。在全国，我们建了10个写字组，就跟你这头部、你的脚部不同的写字组，我建了10个写字组分到不同的单位，我单独管一个胸科。这10个写字组中间，我们在全国呀也做了大量的临床实验。我第一次总结有40多万例。后来呀，他们报的数了，人家都说100万例的手术，5年中间的全国都干这个，做这个事情，所以那时候真是下了功夫了。那么最后做来做去啊，都把这个材料总结出来了。这个结论的结果就说，有一部分人可以用针刺麻醉作为一个手段，在临床去推行，比如说做眼科手术，比如说做甲状腺的手术甚至口腔是不是做这牙的这个治疗什么的，这个做颌骨内关这2个穴也定了，这个效果是70%-80%是不错的。
59年接受麻醉的时候，当时正好处于我们国内的麻醉科在蓬勃发展的初期，也就是说，在50年代以前，几乎就没有麻醉科。和国外相比，我们晚了将近10年。真正的我从事针刺麻醉工作，应该是从1964年开始。那就是说，开颅手术能不能在针刺麻醉下去做？在最初的时候，我们确实想去从科学的角度，用中医的办法，加上我们西医的这个概念，去把这穴位选好。这个经过了很长时间的磨合淘汰，最后选定了一些固定的穴位。最早我们是手捻，一定是要手捻针，保持中医的那个提插得气的这种它的最根本的它精髓的东西。所以针刺麻醉的早期是干针的，就纯粹用针，不允许用别的东西的。但是发展到后来，就我们逐渐的，比方局部的加一些局部麻醉的，神经干阻滞我打一点麻药的。
1965年，周总理提到，就是说， 如果我们国家有针刺麻醉这件事情，但是我们讲不出道理来，应该这个有人呢专门来研究针刺麻醉的这个原理。周总理的指示呢给了钱秀忠部长，钱秀忠部长呢给了北京医学院的院长，然后院长呢来找我说，希望你来做针刺麻醉的研究。我就是从1965年的秋天开始进入到针灸研究。因为针灸它本身有效，经过几千年工作肯定是有道理，但是是不是想到这么样子用针灸可以在开刀的时候就一点都不疼，我内心是不相信的。所以我们的这个党委书记啊，这个副院长啊，童瑞聪老师就说看我不相信啊，他说这样，明天呢我们到北京的郊区，那个时候叫通县的这个有一个肺科医院，他的这个院长是辛玉林，因为我们就去看那个手术，亲眼看到一个女工啊，在躺在手术台上给她做肺叶的切除，她自己一面说话，一面还可以从这个喝这个橘子汁啊，没有什么就是痛苦啊或者皱眉啊、出汗啊这些现象。所以从这里面，我第一次看到以后，我说这里面一定有道理，所以我是甘心情愿的来接受这样的任务。
针麻呢，从1964年开始，一开始做我们就组织了一个多学科的这样的一个队伍，那就是生理、药理，那还有一些生化的呢，那么还有解剖、主胚，还叫物理教研组也参与。那么还有呢，我们就觉得要跟临床结合，所以呢又跟临床的在那里做针灸的治疗的这医生呢也配合，所以这个是很少见的。
曹晓定教授是我的同学，他比我低2班。那么我们同时都是接受了这个国家的这样一个任务嘛。那么在最早，我们的思路差不多，也就是从事实出发来研究的原理，而不是从理论出发来研究原理。在做的时候呢，有一点点差别。我们知道这个镇痛的效果呢，要从空间来看，从时间上来看，所以我注意的更多的呢是时间过程，而曹晓定教授那么呢是注意的更多的是空间过程。我们两个是互相补充的。
我们的这个脑血管病的治疗，还包括很多别的病治疗用针灸，在全国名声非常大，在国际名声也很大。这个院1900张病床，针灸600张，门诊量光针灸门诊量一天得2000呢，我们一天的8000多门诊量。算中国的最大的单一医院，就咱不说蓝体，就单医院是最大的，而且国家的针灸中心在这儿。它主要的靠的什么？针灸的治疗效果好，来的这个地方病人，我不说100%，绝大部分的病人都是这个是痛不欲生的那些个人来了，都得到好的结果走的，比较好的非常好的走的，所以这个国家给的重视度很高，那么我们从而也培养出一大批这个专家来，所以我们现在这个单位正在极盛时期。
我们穴位为什么要用尺子量呢？为了解决标准化的问题。如果大家要是不用一个尺子去度量， 我们取血很难取得很准。我们做一个很小的一个实验，拿一个笔，然后您看它的终点在哪儿？哎，就凭你眼睛判断。感觉。我们再拿尺子量一下。大家看多大误差？其实我们过去针灸效果应该是很好的，但是由于我们就是缺了一个量化，所以今天觉得穴位在这儿长得高了，明天看见穴位在那儿长得低了，这疗效就很难控制。好，所以只有这样的话，把它量化了以后呢，我们任何人去重复，它的疗效都是相同的，
标准化。
所以这就是我们扶针做的标准化。
This patient is a middle-aged woman. He's about 39 years old. He suffered from glioma in his brain. We chose wheel pains on her middle elbow. And the other is the feng is connection, the cortex recycle. And other tools is on the Hegu and the Waiguan. This a recycle. And also fall on his leg, Zhu Sanli and Jin Men, and also the Tai Chung and the other one. I got the 2 cycles.
Here is a clinical study, a typical result of clinical trial. If you compare the blank control, that means patients in waiting list, of course, they have no therapeutic effect, very minimal. Now, if you use real acupuncture, then you can produce a good analgesic effect. If you compare the blank control, waiting list control, with the real acupuncture, then you always get significant difference. There's no problem for that. But if you increase the third arm, the sham acupuncture, then the difference between the sham group and the real acupuncture group may be big enough to produce significance, may be small, but there's no significant effect. Now, why is that? This yellow-red part, meaning the real physiological effect of acupuncture. It can be small, it can be big. It depends on many factors, like acupoint selection, the right acupoint to use, or to use electroacupuncture instead of just manual needling. I would strongly suggest that you take care of the frequency, because low frequency is substantially different with the high frequency. And also the duration is very important. And how about the intervals of treatment? You use every day, or every other day, or once a week. There are a lot of difference there. So if you chose the right parameters, you may get to maximize the physiological effect. If you don't choose the right parameters, you get very minimal acupuncture effect.
Basically, what we've looked at is the opiate system, the endogenous opioids, which have been some of the work that Dr. Han has done from China has elegantly shown that the endogenous opioids are involved in mechanisms of acupuncture. The problem is that the placebo effect is also uses endogenous opioids. So a lot of people think that, well, acupuncture is just a placebo because it's using both, they both use endogenous opioids. So my research with the endogenous opiate system has been to look in the brain to see where receptors change their binding ability following acupuncture. And what we found, which was really to our surprise, was that sham acupuncture looks very much like a placebo effect in that it caused an upregulation or an increase in the amount of endogenous opioids in the nervous system, whereas real acupuncture seemed to increase the number of receptors that were there, and that was a completely different mechanism.
从我们做这个研究的人，我们来考虑怎么样进一步把针刺镇痛的效果再提高一步。我们把临床常用的一些药，跟针刺在动物实验上看有没有结合。一选的话，真还是这个来，有相当一批药是跟针刺有协同作用的。所以现在开始都叫针药复合麻醉，实际上就是针刺跟药物结合起来，共同发挥效果，提高效果。针刺在这里有它的独特作用，它既能镇痛，又能对机体有调整保护作用，所以这点是一般药物达不到的。
Did 25 years of research in neurobiology, and I really think that we're not going to be able to simply map acupuncture onto the nervous system. A lot of people are trying to do that, have tried, still believe you can do that. I'm very excited by the new research that's being done on the relation between acupuncture and connective tissue. The interesting part of the connective tissue are these amazing networks of collagen fibers, and they are directly under the skin. And research at the University of Vermont, mainly from the lab of Dr. Alain Langevin, has shown that when you put a needle in and manipulate it the way you do in clinical practice, the collagen fibers wrap around the needle. And so very often in clinical practice, there's something called a needle grasp that occurs. So that needle it's put in, but it's very hard to get it out. And if you try to pull a needle out, you get sort of a tenting phenomenon. It looks like the skin. And when the treatment is done, then it relaxes again. It's fascinating, and I think that that's going to be part of the first step to suggest connective tissue, because we used to think that that needle grasp was because we put the needle into the muscle, and it was a muscle. And now Dr. Langevin has shown by using ultrasound of the same ways, you can see how deep the needle is in. You don't have to even get close to the muscle to get that needle grasp, and it's probably in the connective tissue.
针灸疗法包括了几十种不同的这些从体表进行刺激来进行治疗的一些方法。那么怎么能很好的来应用这些方法，能够来指导我们的这个临床的实际，实际是我们针灸研究工作者应该去回答的一个问题。我们的想法是什么呢？就是我们应该搞一个针灸临床的指南。那么这种临床指南吧，它就是实际是把我们目前在针灸治疗某一类疾病当中最有效、最安全的方法，客观的介绍给大家的这么一套指南。
In the future, that acupuncture and alternative medicine that's TCM based would be just part of the toolbox that every physician would have, at his or her disposal to use for the right purpose and the right time.
The field is much mature now. We understand better. So we'll face the challenge. We not avoid the challenge. We want to overcome the challenge, but use more innovative method, more deep thinking method to work on that. One of the area people discussing is more effective study. So how acupuncture and Chinese medicine can help patients clinically, rather than look at the specific which effect, placebo or not placebo. More associated with how to help the patient's health condition.
We need to enhance communication between Chinese medicine and the mainstream Western medical profession. We need the Chinese medicine profession to understand the importance of research, so the Western medical profession need to understand Western medicine not perfect either. There are lots of problems associated with Western medicine. So we need to be open-hearted. We need to be sit down, able to communicate in a fair manner.
We need to have more research dollars going into this area, so that we can design cost-effective treatments that will eventually save dollars and money, and it will also save lives and reduce needless surgeries, reduce needless side effects. A lot of the things that Eastern medicine has to offer are really, really nice and really, really, I think, beneficial.
The future effect should focus on fine-tuning of the conditions of acupuncture and the parameters of electric acupuncture in order to maximize the analgesic efficacy for patients suffering from chronic pain. So much for the acupuncture treatment of pain and drug addiction. However, acupuncture can do much more than pain and drug addiction.
So if there is one message I can impress upon you today, it is to urge you to continue to be leaders on behalf of acupuncture. I know that I will continue to be a voice for you in the capital, but let's continue to be partners, and together we can ensure that acupuncture is given the respect it deserves.